Doctors and discoveries for Hawaii. Doctors who train in Hawaii stay in Hawaii and practice with aloha on High Now on Sunrise and HighNowDaily.com. Sponsored by University Health Partners of Hawaii and the John A. Burns School of Medicine.
Once you reach a certain age, your doctor will tell you it's time to see an internal medicine physician. So just what is that? Well, Dr. Elizabeth Tam, professor and chair of medicine at the University of Hawaii John A. Burns School of Medicine, is here to tell us. Aloha, Dr. Tam. Thank you for joining us.
Aloha. Thank you for having me.
Yeah, so tell us a little bit about what your team sees. What are some of the medical issues that you all deal with?
Great. So our internal medicine physicians are actually trained to handle specific problems in adults. That is to say, people are 18 years all the way to 120 years old. Mm-hmm. So many of our patients have chronic diseases such as high blood pressure, they've had a stroke, they may have asthma or heart disease. But I did want to mention that we also focus on keeping you healthy. Mm-hmm. So as soon as you turn 18, and you don't have to wait for a certain age, come join us, and we really try to keep people healthy and work on prevention and screening.
Okay, I have to come see you. No.
Yes, you do.
All right. Well, I also understand that you have a pretty large residency program. Tell us a little about that.
Great. So actually the UH Department of Medicine actually oversees the largest internal medicine residency program in the state of Hawaii. Wow. Each year we accept at least 20 interns from a field of 2,000 applicants. And our trainees stay with us for 3 years to learn how to take care of these problems, to identify and treat them as people enter their adult years and age. So we've been dealing with that for many years. I did want to note that because of the primary care shortage in Hawaii, we recently started a primary care pathway. So our residents who select to be in that, we encourage them to deal in primary care problems, and we try to teach them all the skills needed to have a successful and effective practice in primary care.
So how does this residency program actually benefit the patients?
Oh man, it's great. Our patients tell us routinely that they learn a lot from our program, because as we're teaching alongside the residents and the students from John A. Burns School of Medicine and the University of Hawaii Hilo Pharmacy School, we're all learning together. In fact, I consider our patients our best teachers, and they're learning along the way as well.
All right, Dr. Tam, well, how can they make an appointment?
Easy enough, just give us a call at 536-3773, and we can make an appointment right away.
All right, Dr. Tam, thank you very much. We'll have that number posted on our website, HighNowDaily.com.
Sponsored by University Health Partners of Hawaii and the John A. Burns School of Medicine.
Here in Hawaii, we have some of the best diving in the world, which also puts divers at risk for the bends or decompression sickness, which is why the University Health Partners and John A. Burns School of Medicine find it crucial to have a hyperbaric chamber available at all times.
So hyperbaric oxygen therapy is giving 100% pure oxygen in a pressurized room or tube. We increase the pressure to about 3 times normal atmospheric sea level pressure, and that allows us to get very high concentrations of oxygen into the lungs and into the bloodstream. We have a lot of divers in Hawaii, not only recreational but commercial divers, researchers, the military, and we serve as a primary emergency treatment center for all of the public here in the Hawaii and the Pacific Rim. So it's very critical that we have that, and we're lucky to have one of the few hyperbaric chambers in the country really that are available 24/7. The next nearest hyperbaric treatment center is 5 hours away in San Diego. So it is critical that we have this resource here in Hawaii available to patients who need it right away. We have a multi-place chamber, so we can accommodate multiple patients or very sick patients that need additional treatments or IVs, things like that.
Patients initially were treated because they had dive injuries, and then you realize that they got better because they had more oxygen in their bloodstream, and We extrapolated that to other diseases where patients had impaired blood flow or had injuries or had infections, and therefore we've learned that it's useful for multiple different things, from wounds that won't heal, radiation injury, from treatments that patients need for cancer, inflammatory bowel disease, and carbon monoxide poisoning. Not only does it get more oxygen to the places that need it, it also stimulates things like growth factors and stem cells to help heal wounds, help improve the overall blood supply to certain areas that may have impaired blood supply, and things of that nature.
Back in the year 2000, I had stage 4 throat cancer, and I had what you call an occult tumor. They had to shotgun radiate the whole side of my face, and it was very traumatic on the tissue. In 2010, I came down with a jaw infection and had some dead tissue, and I went through the 40-day treatments out of 50 days, and the infection was gone, and I was basically healed. Feel better physically, mentally, feel stronger, and it helps different patients in different ways.
Quite honestly, people seem to feel better in the chamber, and it's one of those few medical treatments where people sometimes feel better after than before.
Sponsored by University Health Partners of Hawaii and the John A. Burns School of Medicine.